Welcome to the How to Die in Mexico podcast. We help expats live better in Mexico by addressing end-of-life worries and fears through education, contemplation, and planning resources. I am your host, Sarah Mae Conway, author of the book, How to Die in Mexico, and you can find me at dyinginmexico.com. Today, I'm speaking with Brittany Baker, a nurse and founder of East Cape Home Health in Los Barriles, Baja California Sur.
When do people come to us? I would say usually it's not like it's too late, but sometimes it's a case where it's like, oh, I wish someone had talked to us earlier.
Brittany is also an immigrant to Mexico from the US, and as a medical anthropologist, she has some unique insights into the special needs of expats who wish to age in place in Mexico.
Death is is the most natural thing, just like birth. Letting that happen in the body, go through that process the most natural way possible is what most of my clients are looking for.
You can learn more about Brittany and her business at eastcapehomehealth.com.
Having a nurse who is well seasoned and identifying these things, what's normal, what's not, what can we expect next, and kind of preparing the family, guiding them through that. And that is also, part of our service as well.
May this episode be of benefit to you. And if it is, I would greatly appreciate your support in the form of a like or a follow, or better yet, leave a review. I thought maybe that we could start with just, if you wanted to say a little bit just about yourself and where you grew up and how you found nursing, and yeah, just starting from the beginning, introducing yourself.
Okay, cool. Well, yeah, it is kind of a long story. I'm originally from Seattle, Washington. I got my first bachelor's degree in medical anthropology and global health from the University of Washington. And then I went to study nursing school at the University of Miami. And a lot of people, the first thing is like, wow, that's such a big, geographic difference and culturally as well. But, the reason I chose to go to the University of Miami was because I already spoke a little bit of Spanish. I took, Spanish in high school like everybody else, but I knew like the best way to keep with the language and the culture was something that, I had to practice, practice, practice. So I went to nursing school in Miami, graduated, worked in Miami for a few years. And in Miami, I actually worked in high risk OB, which is like totally different set of what I work in now, years later. And then I ended up in Los Barriles, which is about an hour and a half south of La Paz, Baja California Sur, kind of equidistant here between Cabo and La Paz. And when I came here about 10 years ago, it'll be 10 years in March, I was kind of I had left my old job in Miami. What do I want to do? I wanted to transfer my nursing license to California. But in that time, in this community, I met a lot of people, a lot of tourists, a lot of expats, and a lot of them, older in age. And they would say, we'd be sitting at the coffee house having a latte in the morning. Winnie, you're going to take care of me when I'm older, right? You're going to take care of me. And I would say, love to, Dave, but, I'm only one of me. And so, little by little, I started meeting more friends, more people in the community, and they needed help. And I started building a network of caregivers, local Mexicans who had experience taking care of older adults, and then nurses, got a network of nurses. And little by little, like, people started contacting me about how we can help, their family member, their loved one, really live a better quality of life.
Yeah, yeah, yeah. And that kind of like brings up a point of, because I live up in north of you, but yeah, also in Baja California Sur. And I don't know if this has been your experience, but yeah, when I first moved here, it was so hard. People weren't working online yet, and it was so hard to even maybe get online access. And so, kind of the expat community was a lot older and skewed towards like, oh, everybody's retired, everybody's, aging. Was that kind of your experience in Los
Yeah.
Barriles? Yeah.
I mean, personally, like socially, the only people around my age group, I was about 28, 30 when I came here. They were all definitely much older, seniors, and it's really cool. These people, a lot of them have been here for 30 years or 40 years. Maybe they built their dream house years ago, and they want to stay here as long as possible. And we make that possible for them. But and it was hard to maybe find a social group or people my age, friends. I mean, I ended up marrying a local and having my kids here just because, and now I have a network of probably, and to be totally honest, Sarah May, that my friends my age are Mexican.
Yes, yeah. Yeah, and I imagine too, like, because I really get the sense, and I think it's true that you really created this, home health care, like, that service did not exist before you
Absolutely.
had got here and created it, right?
No,
Um,
absolutely. And that's important for me. I was always I feel like people say once you're an anthropologist, you're always an anthropologist. So that's like it's like nobody studies that. You don't really work in that. I mean, there are jobs at university, but really that gave me a basis for, being a good nurse and for starting a business here because it's a lot of understanding cultural differences and what is the cultural need? Where's the niche there? What does the community need from me and how can I serve them? And so, it kind of took little by little understanding, I don't want to invent something that people don't need, and it really just kind of organically grew little by little to become something that did not exist before. And yeah, it's pretty cool that it does now.
yeah. Yeah, and is your clientele, like, mostly an expat clientele? Do you serve a mix of both? Like, who's really, like, needing your services the most?
Yeah, it's definitely a cultural difference. I would say we're 80% expats and 20% Mexican. So, I think literally right now with like if I have 10 clients, 8 are gonna be, expats and 2 will be Mexican. But culturally there's a difference there as well. I mean, we see the family style caregiving environment among the local Mexican community where you have multi-generational households, you have, grandkids and kids living together with grandma and granddad. So when someone gets older and weaker or any type of, cognitive decline, they've got the family member close by, and it's much more normal for them to be around grandma and grandpa and take care of them themselves. So rarely do we get asked, and when we get asked to help out, we're happy to be there. But in general, my clients are people, like I said, who have lived here for 30, 40 years, built the house of their dreams. They want to keep staying here. They want to live here as long as possible. They want to die here as well, And so trying to make that happen for people so that they can live the best of their years here while they can. And every day, more and more that's possible because the medical care in general is just getting better and better. We're having, great world-class hospitals in San Jose and Cabo. And even in La Paz, the private hospitals are very good. And we've got more and more English-speaking doctors. And a good quality of healthcare is possible here.
Mhm, mhm. Yeah. Yeah, because 'cause I'm thinking too, I'm sure you kinda had this awareness or at least heard the stories of, like, how people were dying before you started your business or what, like, was the norm for
Yeah.
expats as they aged, Or were they going back to the States or, like, maybe give a picture of, like, what was going on?
Well, I mean, there's still a need for a lot of help down here. I mean, imagine, for example, an older person falls, they're 82 years old, and they break their hip. One of the saddest stories is like a lot of times, and this probably happens in the States too, is that the person who fell is stuck on the floor for maybe 24, 48 hours until maybe the gardener or the cleaning lady comes by and checks on them. And then they go to the hospital, they get a surgery for a broken hip. and then they go home. But, after a hip, there's a lot of care. You can't move your leg. You can't, bend it a certain way. You can't rotate it. You can't put any weight on it. You know, how was this being done before I opened a business here? Well, it was the same gardener or cleaning lady that came in the door to help them out. There was neighbors and people that would step in and be supportive, friends, neighbors, but not people that are, maybe trained or have the knowledge level. So it was really just like, I would say, professionalizing something that already is and is being done by locals and friends and family, but just having a better quality of care because I've had to train all of our employees as well because that's something locally as well that you won't. It's really just because it's a small town, La Paz and Baja California Sur, that they don't have, caregiving training. They don't have, this specific niche of work that is formalized or professionalized. It's not like a school for it, kind of like, I mean, you have nursing school, yes, but it's not like in the States where you can be a professional caregiver. You know what I mean?
Yeah. Yeah.
That did not exist here, no.
Yeah. Yeah, and are you I noticed on your website, you have a variety of services that you provide. Like, what would you say is like, you know, when does a person typically come to you for care, and what does that look like? What is the care that they most likely need?
Well, let's see, I would say when do people come to us? I would say usually it's not like it's too late, but sometimes it's a case where it's like, "Oh, I wish someone had talked to us earlier. Oh, I wish you had talked to me last year when it's usually, "Hey, I've noticed, my neighbor's been forgetting a lot of stuff lately. He's not taking showers regularly. Can you come take a look and see, what kind of recommendations you have?" And it's usually something that's like, maybe there was warning signs ahead of time, but there wasn't maybe a family or a support group or anyone to kind of raise an alarm bell to get us in there to be of service beforehand. Ideally, what I would like is, someone notices, maybe it's not just memory changes in an older adult or senior. Maybe it's their behaviors changing, their personality is a little off. Because a lot of times regular memory things we contribute to normal aging process, right? But it's that short-term memory things that is traditionally thought about as dementia, for example. But when that's something that we're working on too in social media, we're trying to put more education out there in Spanish and in English too, because I want the community to know like we are experts in what we do. I have a specialization in nursing geriatrics. I'm a certified dementia care practitioner. These are things that I have to, every 2 years recertify myself, keep learning, be like most updated in the science of how to best provide these services and understand my clients as best as we can. We are, the best is what we do. And I wish people would come to us sooner, because sometimes there's medication, there's interventions, there's things we could do to prevent maybe the decline so rapidly and give them a better quality of life. And as far as, what care do they need when they come to us, I think so we do a variety of services, like you said. I mean, um, it could be like the example I said of someone who fell and broken their hip. They'll say, "Hey, dad's coming out of the hospital on Friday from a broken hip. Can you provide a nurse and a physical therapist for 6 weeks while he gets recovered?" Sure, that short term, respite care, or where the point of that is to rehabilitate the person, get them back and to be independent as possible and recovered and get their strength back. Those are like short term cases that we do. And then we also do longer term cases, which is going to be like a dementia care patient who, needs 24/7 care. We do the cooking, we do a little bit of the cleaning, we do a little bit of everything. And I always joke with my clients, what do we not do? We'll do, and that's one of the things that sets us apart is that, when a nurse comes to your house to check your blood pressure and check your medications, it's also, does the dog need a walk? Do you want me to take the garbage out? Have you talked to your son this week? Have you, kind of just a little bit more thorough care rather than just coming in and seeing, that checking off boxes, right? because there's a person that is dealing. It's person-centered care is what we call it. It's not just like the illness that we're treating. There's a person and they have needs that sometimes are not just medical, right? And that's one of the things that I'll see with a lot of other maybe nursing agencies in the States, because there are a couple other ones, and what really sets us apart is that our nurses are so holistic in nature, and that it's not it's a lot of these are vulnerable people we're usually taking care of, that don't have a support group, that don't have anybody looking out for them, protecting them from people, predators, anything that might happen. And we kind of look at that and figure out how can we keep them safe and keep them happy and keep them living here as long as possible. So what kind of care that they need? It's very diverse. Everybody's needs are a little bit different, but it can be as little as, a nurse visit once a week or, monthly. We have a package where we do stuff like that. A nurse comes once a week, and maybe we like to get a physical therapist in there a couple days a week. And then to as far as like 24-hour care, but really we do a little bit of everything.
Yeah. 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 It's so funny. Like, I was kind of thinking before this meeting, like, what kind of questions was I going to ask you? And, this question about like, when do people typically come to you for care? Like, I immediately wrote down also, like, what would help them get to you sooner? Because,
Yeah.
like, I just know that, like, this is just like, I think a very human thing that we like age and we are moving towards end of life. And there's, maybe it's denial, maybe it's lack of awareness, maybe we just don't have that person that's like, hey, it's starting to look like you need help. And it's
Yeah.
like,
Yeah.
more often than not, like, "Oh, man, like, you would have benefited from starting this process, like, a year ago or more."
Yeah. And it's a very delicate subject, right? Because
Mhm.
no one wants to be told they're old and they need help. No one wants to hear that, and but aging is a part of life, and we're all going to have, moments when we're more or less independent. And I think what I want, people to understand is that we really promote independence, autonomy, so that you can make decisions and have power as much as you can over whatever's type of life you want to live, right? And everybody wants a good quality life, right? And so, coming to us with even just an early warning, maybe I don't need a caregiver right now. I don't need someone to come in right now. That's fine. But one of the other services we also offer is what's called geriatric care management. And, I really shouldn't call it concierge VIP geriatric care management, because we really kind of go above and beyond that when someone, has a complaint. Um, saying, well, you know what? And really, because we work in a very rural environment as well, we're an hour and a half from each cities, north and south. So we don't have a lot of specialists. We don't have CT machines. We don't have MRI machines. We have kind of the very basics here, and kind of triaging the situation. Maybe you're having a crisis with a family member and saying, okay, well, immediately, what what kind of action can I recommend immediately, and what can I help with now? Well, we have an internist who's coming on Saturday. If it's more immediate than that, can I make an appointment for them to get an MRI in San Jose? I'll figure out how much it costs, make the appointment, arrange the transportation, um, make sure the person has all their medications. Are they getting the best deal on their medications, right? I mean, we work with pharmacies that give us, good prices, and are on top of it and say, on the 18th, so and so is going to run out of their prescription. We need to order another one. Keeping all of that organized and streamlined, so that when someone is having a crisis, or even to prevent a crisis, to just know that someone is keeping out for this, keeping a lookout for this person. Making sure that everything's under control and having someone check on them once a day. It can be very minimal, the type of interventions we do, so that the person still has their autonomy, their independence, as much as possible. That's what we want to promote, right? We don't want anybody to become dependent on us. And I think sometimes that can be a delicate line too, because I've had a client say, like, when you guys are here, your nurses are here, I feel like I'm on a cruise ship because you do everything for me. And now I don't want you to leave, and And so it is this line of, providing a service that we do take care of you, but at the same time, we don't want you to become dependent, unless that's what you want. I guess, if that's what they need and they want us to become dependent, that's great. But, we're not out here just trying to, promote, 24/7 dependence on caregivers and nurses. That's also not our goal. So people can
Yeah.
still they can feel more comfortable approaching us and asking for advice or saying, "We've got this situation. What do you recommend?" Um, that's something that we're here for too, to help
Yeah.
navigate that stuff.
Yeah, the independence, the autonomy, the feeling like you have agency is like a really big deal. And I'm curious, is it usually like the patient themselves that's contacting you, or is it a family member, like you said, a neighbor that's like,
Well, it's rarely the individual themselves, to be totally honest. Very rarely is it going to be the individual themselves. It's always a referral from a child, a neighbor, a concerned friend. And because a lot of times, when someone is in a position of risk, you're not gonna note that yourself, and it's also like you said, and I I see that maybe the type of people that Baja attracts are these kind of fiercely independent. I drove down the Baja all by myself, with my German Shepherd in the back, with no real plan of I was really only going to stay for 2 weeks, and now it's been 10 years. That's the type of people, your circle friends and people like me. So, it is this personality of they can be very defiant, and that's hard as well because it's a fine line of respecting the wishes of a person that doesn't want help, for example. And that's really hard for us as well because it can be a very sad situation sometimes of someone who's maybe very isolated, very lonely, having a physical decline, a cognitive decline, and all the friends and neighbors are worried, but the person keeps refusing care. And that's as much as we can do is offer and provide counseling and direction. Um, but that is hard for us, for our nurses to watch. But I think that is a common situation in a lot of areas throughout the world as well. You can only help someone so much, but I do see a lot of sad cases of older adults who have, I don't want to say abandoned by their children, but it is they haven't come back to visit in 5 years. Maybe when mom and dad built this house, and in 1995, they would come back and visit every summer, and now it's been so many years, they don't come and visit, and there's in a state of deterioration, and no one's checking on them, and now they've got maybe full-blown Alzheimer's, and, they don't wanna deal with it. Um, and it breaks my heart, but I know that, at the same time, it's hard. I don't want to judge people for their situation or the decisions they make or the lives they've lived, but that's just kind of part of my job as like a counselor and kind of managing these situations and helping people get as much information they can so that they can make the decisions that they need to make for their family and being here as a support.
it can be really, really important to have someone like you that could get in contact with the family, and that it
Yeah.
could also be really heartbreaking to get in touch with a family that maybe, yeah, isn't ready to rekindle that relationship with their parents or what have you. Yeah.
Yeah. Yeah.
Yeah. And so I imagine that too is sort of like, there are pros and cons to, first of all, just being in having this type of business in Mexico, where you kind of alluded to, like, you can treat people a little more holistically. Like, you're not as tied as you might have be in the United States to, say, health insurance protocol or billing things in a certain
Mhm.
way,
Mhm.
or, the tightness of a structure that there you might find around a business like that.
Sure. Sure.
Um, what has, like, doing this business in Mexico kind of allowed you to do, and how is it more challenging?
The business in general is very challenging in Mexico. There's different laws, and throughout the years I've had to learn a lot because I would say I'm a nurse. I didn't study business. What am I doing? I'm just answering a call and I feel ill prepared. But we've learned a lot along the way. how to provide, the best services and care, and run a business as well, because it's not for the weak of heart. And we're, working in a different country, different language, different laws, different rules is definitely, proven hard to navigate. But in the good sense too, or in the pros, I would say, yeah, exactly like you said, we don't have red tape, right? So a lot of cases would be like, we have a patient who, a male, 75, kind of new to our care, swore that before he came down to Baja, he had a full health workup, ultrasound, screening, everything, but he was having difficulty urinating. And so I said, you know what? The urologist can't, we don't have a urologist, but there's a radiologist that comes on Friday. Let's get you checked out. And they do an ultrasound. What was it, $50 out of pocket, and they saw a lump. And the lump, so she talked to a urologist, got him an appointment on Monday, and within a week he had tumor removed out of his bladder. And he had to pay out of pocket, but the ultrasound, like I said, was like 50 or $60. The doctor consult, $40. And then the surgery, you know, 10, 15 grand. And it was something that you don't have to deal with the insurance company. Yes, it's paying out of pocket. Yes, that's a lot of money. I'm not going to minimize that. But at the same time, the quality of the care, how fast it was, he didn't have to ask for authorization. He didn't have to go through his insurance company. It was like bing, bang, boom. And so we do see a lot of cases like that when we do have a problem. It's like, well, I can, the MRI, I can get you an MRI on Thursday. It's about $300. And then we'll get you to see the internist on Saturday, and that's $70.
Hmm.
We can do things faster, and it's a better quality in a lot of cases. We just see really good results. And also, like our physical therapist, well, you have to get approval for a physical therapist. Like, no, I recommend every single one of my patients who's over 65 have a physical therapist every week. And if you're over 80, 3 times a week, because you got to keep, your legs strong, your coordination, your mobility is so important for your quality of life, and so, and how much does that cost out of pocket? $50.
Hmm.
I mean, in the States, it's at least 200, to come to your house as well. Also, that's at home service. And so these are things that, like, at home, and it is, Mexicans make very good caregivers and very excellent nurses. I'll tell you that, and it's kind of goes back to that cultural reason of the the multifamily household, you know. I think in American culture, when grandma and grandpa gets weak or has an accident, they kind of immediately go to an assisted living facility. They go to some sort of shared group home. And so the children, the grandchildren, everyone has less and less contact with older adults with dementia, right? It's more normalized for us. And here in the Mexican community, because they don't have that available to them, they are, I don't want to say more empathetic, but I would just say that they're more experienced in dealing with people who have a variety of cognitive deficits, right? So, when someone's asking the same question, 20 times, can I go to the bathroom? Can I go to the bathroom? Can I go to the bathroom? They're just experienced because, they lived with grandma and grandpa through this. They lived through their great aunt so and so, their cousin was in the same house, and, you know, they're more exposed to it. And so I think they have more practice on how to be empathetic.
Yeah, yeah, yeah. I imagine, and just like the comfort level, like you're saying, of having seen it, having been around people that are aging, having been around people that are dying, and just how that changes one's comfort level. And probably, I don't know, does that make Mexicans better patients as well?
Yeah, no, I would say, they Mexicans as patients, we also run into, the I don't need help. I'm fine. Grandma's fine. I don't need it. I'll just, or they don't want to help. They're very independent, fiercely independent as well. And so, even though they may have a great support group of family members that are trying to support them, they'll say, you know what, I'm too busy. We've got too much going on. We need help. And I think the difference here for me within the Mexican community really is the language difference, because Obviously, I don't need to look for a nurse or a caregiver who speaks English to take care of a local Mexican who needs help in their home. And so that's a lot easier for me. Um, I was, one of our struggles of what I was saying, where might someday soon offer work to like um, legal residents here who are expats, because the language barrier is so hard, especially when we're talking about older adults who might have hearing problems or cognitive problems. Communication is so important. It's just key.
Yeah, yeah, from your, maybe from the background that you have in, like, the medical anthropology, it's like, um, these things like, yeah, the cost, the language barriers, like, is there how would I put this? Like, is there eh, what who's the expat that does the best, if that's even a fair way to say it, does the best towards end of life in Mexico? Like, can you talk a little bit about the value of learning the language or the value of, like, integrating into the local community? Uh, yeah, who ends up having possibly, like, the best chance for comfort at the end of life? Or maybe
Um,
it's not about culture, maybe it's just about the planning or something else.
Yeah, I would really say it's more about planning, to be totally honest. When we talk about end of life care, there's important point that a lot of people forget is that when you have your advance directive or your will in the United States, that's not going to be legal in Mexico. You have to come to a Mexican notary or lawyer and make your a legal document in Mexico. And so it does get complicated, because someone can say, well, I'm mom's power of attorney and I say no. And it's like, well, that document technically is not legal here. Legally speaking, your rights at the end of life are not like it is, I don't know, Oregon, Washington, um, where those rights are respected. For example, you have a DNR. Now, most people, if you have a DNR, you don't, it's a document that says, that I want CPR, I don't want CPR, I want IVs, intubation, I don't want IV intubation, and you sign it. And there's a witness that signs it. Now, that document is not technically legal here. And so say you had an accident and you went to the hospital and you didn't want to be resuscitated, right? Let's say we're just going to go in and do a quick hernia repair, and they take you to the hospital. Well, during the hernia repair, maybe there was a complication, bleeding out, patient flatlined. The doctors there are not going to respect an American DNR. They're going to take their oath makes them legally responsible to do everything they can to save your life in that moment, even though there was an American DNR at hand. Okay. So that is something that, I have to kind of counsel my clients too, that like when you're at home, I can, do my best to respect your wishes. But the moment you go into a Mexican institution, if you don't have all that paper notarized by Mexican documentation, I can no longer guarantee that your wishes will be respected.
Mhm. Yeah.
Um, and so definitely planning ahead, is going to get you what you want, as far as, what kind of a life you want to have. And that's going to take planning ahead of time. And it sounds macabre at times, because you're like, well, I'm only 65. Why would I do that paperwork now? Do it now. Why not? Like, you never know what could happen. A lot of times people wait until they're too ill or too, incapacitated to be able to do the paperwork, and then it's too late. So I always tell people, when you're coming here to visit mom and dad in Baja, come prepared. Come with, a birth certificate, your ID, whatever you need, to kind of get paperwork in order, whether it's the fideicomiso on the house, whether it's getting your name on the bank, just in case, stuff needs to get taken care of. I always say, take advantage of every trip you come down here to visit your parents, to kind of start getting that stuff, that paperwork in a line and taken care of, sooner rather than later. Making a plan and having your family aware of your plan as well. And even if you don't have your paperwork taken care of, your notary. The most important thing is also just going to be having these conversations with your family members. Whether or not you're an organ donor, what kind of care you would want, worst case scenario, how long, the stuff nobody wants to talk about, okay, well, if I'm hooked up to life support for more than a week, unplug me, you know. You need to have those conversations, right? Because then your kids are left stuck trying to figure out, well, I didn't know. Did you ever talk to mom about that? I didn't talk to her about that. Do you know what Aunt Cindy would want? I don't know. I didn't. We never talked about it. And so that would avoid a lot of problems as well. And also just as an individual, these are things we need to talk about too, um, deciding how you would like to go best case scenario. But also keeping in mind that, at least in this state, things like death with dignity are not legal. So, you know, this is a very conservative state. So the idea that, like, you can say, well, I have a terminal illness, give me the happy pills so I can go to the great beyond. No, that's not legal here. You're gonna have to, if that is what you decide to do, there's gonna have to be a much more creative way to do it, because you're not gonna be able to find a doctor or a nurse to assist you in any of that, because it's not legal. Um, um, for example, yeah, like whether or not you want food or water at end of life, those little things are things that we need to start thinking about ourselves too. And what does death look like for you? There's a lot of people around that know a lot more about maybe like spiritualness of it, but just being able to be open to have those conversations, right?
Yeah, this discussion around, not eating or drinking at end of life, and I want to stop eating and drinking because it's and tell me if I'm wrong, but it's my understanding that access to pain medication such as morphine, for example, is way more challenging here in Mexico.
Yeah. Oh, that's also a good
Yeah.
point. Politics aside, getting morphine, fentanyl, any of these pain medications is actually very hard in Mexico. It is controlled. And I will also say to people, I worked at a urgent care clinic here locally in Mexico. I worked at a pharmacy. Do not buy any medications from a pharmacy that will sell you this kind of stuff without a prescription, okay? Because then you don't know what you're getting. So a lot of people are like, well, I can go to whatever pharmacy in Cabo and they'll give me whatever I want. Okay, well, you need to understand the social politics of that and what you could be purchasing. So, whether the fact that these medications are controlled, I respect, and I think that's important because that gives the consumer more faith in what they're purchasing. There is several pain clinics. There's two pain. There's not several. There's two. There's a pain clinic and a palliative care clinic in La Paz. And that is a place where you can go. You can get a consult if you have chronic pain. And the only other doctors that might have prescription for morphine is going to be an anesthesiologist. But the problem is anesthesiologists do not just consult. They don't have like an office, like an internist or a urologist that you can just walk in there. It is a little hard, and but I would recommend, the pain clinics in the pause. But then, I have trouble too that, I'm in a small town. So that means I have to send my terminally ill patient all the way to the pause in person who's, bedridden to go get the prescription. Um, it is hard. Yeah, we do have other pain management options like codeine. We have buprenorphine patches. So there's other things that we can do to mediate pain that aren't as strong as morphine. But there are, if you have a family or representative, or we'll do what we can to, for example, help you get that medication from La Paz. But
Mhm.
it is a struggle.
Yeah. Yeah, and hopefully this is part of what people uh can become more educated on or more aware of or plan for if they are choosing a place like Baja California Sur for end of life.
You really need to, not underestimate how much, someone who is a professional who does this for a living can really provide a sense of peace and tranquility during this time, because death is one of the is the most natural thing, just like birth. we all birth, we're all gonna die. It's one of the most natural things that can happen to us. But letting that happen in the body, go through that process the most natural way possible is what most of my clients are looking for, right? And so having a nurse who is well seasoned and identifying these things, what's normal, what's not, what can we expect next, and kind of preparing the family, guiding them through that. And that is also, part of our service as well, is helping them make arrangements, whether getting the funeral service arranged, and just the logistics, because it can be really hard. One of the things that is the Mexican bureaucratic system in general, because when a foreigner passes away in Mexico, there is a different protocol than if a Mexican passes away, right? So you do have to go to the Procuraduría Justicial, which is going to be where they do like a police report, and they will interview you about your loved one, what happened, and if that lawyer decides that there was no malicious involvement, that the death was completely natural, we can hope that they won't do an autopsy. But the truth is that the American embassy in Mexico has asked the government that for every foreigner who passes away in Mexico, there must be an autopsy. That's more just like geopolitical um, politics, that they want an autopsy. Now, I can't just ask the Procuradora Judicial to not do an autopsy, but what I can do is I can help prepare a statement for the police, for you to kind of explain their medical history, their most recent labs, kind of provide background that, you know what, this patient was suffering, this was going on for a long time, there was nothing malicious involved. And then with that information, the lawyer at the capital office can say, no, this person was 95. Clearly, it was natural causes. We don't need to get an autopsy. But I think for a lot of people, for personal or religious reasons, don't want an autopsy. But that is something that you should also consider as well as a foreigner. There's no way that I can guarantee, even if your death was as natural as possible, there's no guarantee that you won't get an autopsy.
Is that relatively new? That's fascinating because you do see a lot as I'm researching about end of life in Mexico. You see a lot of these warnings like, oh, if you're an expat, do not call the police, just go straight to your doctor, just get the death certificate, bypass the police altogether, don't call the
Yes, I've
ambulance.
I've heard I've heard that as well. And the information I got that from was in Ajijic, Jalisco, or other parts of Mexico. So, I'm speaking from a very rural town where we don't have any doctors that will go to your home unless they are very, very rare. They're private doctors. So in order for a physician to do a death certificate at your home, it has to be a doctor that is Facilitated? Affiliated with the government. So that means they have like a special prescription pad or doctor's note or affiliation with a government hospital, and that person can go to your house and provide a death certificate. So here in my town, we do not have anybody yet that is able to do that. We don't have a doctor. So when someone passes away, we call 911, and the first person to
Mhm.
show up is the police. Okay. And so I do understand also the concern about, oh, well, then the police come into your house. There's rumors that they'll like steal your passport or steal your money or whatever. But, in my small town as well, the comandantes, my number one contact, we keep in you know, talking to the police officers. I always tell them when I have a case of a client who is, reaching, maybe the last few days or weeks of life, and I tell them ahead of time so there's no surprises. And they know what's going on. But, I think a general precaution is, yeah, if you have to have a police come through your house and check the scene of the crime, um, put your belongings away. I think that's a standard precaution. Put your belongings away. There is corruption in Mexico. I'm not going to lie. I don't, you never know. You never know. But here in my town, we cannot avoid the fact that your primary care doctor is not going to go to your house and sign a death certificate. And I think a lot of small towns might be like that as well.
Yeah, I think it's the same here too. Yeah, typically if people pass in town here, there's not a funeral home involved. Even the idea that of a doctor coming, the doctor's 2.5 hours away. So it is the police that are right here. They're the only government official, so to speak, in
Yeah.
town. Yeah.
And yeah, so you know what? That would be my recommendation to anyone who maybe is has a neighbor or a friend and they're just like, what's going to happen? Things don't look good. What should we do? I would just go talk to the police and tell them what's going on and be honest. And then when they show, because imagine you're, the head of police and you get a phone call on your radio that an American has just suddenly passed away in their home and they run in, the guns blazing, thinking they have no idea what's going on. So when you give them a heads up too, that like, hey, this person's not doing well. They decided to die at home. We just wanted to let you know. Um, and and then it's better when you have someone, like an agency or someone like us with experience to help be kind of the third party in that situation if at all possible. But, people can also learn from from our mistakes as well.
Yeah, yeah, absolutely. Yeah, and do most people or most expats, for example, die in their home, do you think, in Los Barriles?
Oh, I don't know that I have enough data to make a real assumption on that, or a real comment on that. But I think whenever possible, most people choose to be at home, right?
Mhm,
And that's true. That's something I learned during the pandemic too. That's very true among the Mexican population as well. And that's something that is really near to my heart. Is kind of sharing some of my knowledge and expertise with them on how to make the most peaceful transition possible, right? So that because I remember during the pandemic, people would be so sick with COVID, they couldn't breathe and they would not go to the hospital because they said, well, that's where you're gonna die. I don't wanna go to the hospital because then I'm gonna die because people go to the hospital to die. And, that was a cultural belief before COVID. It's definitely still a big belief because COVID kind of unfortunately did reinforce that because when the people were really, really sick is when they went to the hospital, but by that time, it was usually too late. And so there's a lot of trauma from that situation of not wanting to go to the hospital. But then when they're at home, um, it's, "Oh, grandma's not doing well. Brittany, we need to get her an IV of fluid. Can you come give her an IV of fluid?" Okay, and I'll go and talk to the family and like an IV of fluid is just a big, bolus to what? Prolong the inevitable, to just
mhm,
prolong the suffering, and so I get that opportunity to maybe talk to the family and say, do you really want to stop death? Because you're gonna make things harder and more difficult and more painful. And so culturally, that is also a big difference too, is that I would say the local community tends to have, and I don't know if this is like a lot of Catholic trauma that they have, that you have to do everything for mom. And if I don't do everything, I'm a
mhm,
bad daughter. That you have to do everything you can to save their life. And I come from a medical field that, really doesn't want to over medicalize death. Like, I really don't want to over medicalize it. We just want to provide support, um, and also understand that, you might get to the point when there's nothing you can do,
mhm,
you know, and also having that conversation with their parents as well. And having these conversations about, how do you want to die?
mhm.
These are just conversations we all need to have, regardless of where we come from or who we are or how old we are.
Yeah, yeah, so valuable. Yeah, and that's so fascinating that, you know, across cultures, we all kind of experience this death denial to some extent, or just this longing to want to do everything possible, but maybe for different reasons, whether it's
Yeah.
Catholicism or whether it's just a lifetime of like medicalizing everything or thinking that we can cure everything, that science will take care of it somehow or
Yeah.
whatever it is. Yeah.
Yeah.
It's so amazing what you've done and what you've built up there in Los Barrios, and I really wish more of our rural communities in Southern Baja had access to these things. Yeah, and maybe just is there anything you wanna say about just what you I know we can't, like, know the future, but what you see or hope for, what the future of death care or home health care might look like, could look like in Baja California Sur?
I my Goal right now, my motivation is to kind of grow our area geographically so that more and make it more affordable and grow it to the community, but also to provide actual certification. So professionalizing the local Mexican community, whether or not they work with us or for us, it's going to be giving them skills where they can become better listeners, better caregivers, better support people for their own families as well. And just providing that education, whether it's, to the Mexican community or to the expat community, just kind of providing more professionalized education to the people in the community.
Yeah, yeah, that's fantastic. I love
Thanks.
Cuban, and
Thank you,
your
Sarah.
community is so lucky to have you.
Thanks, Sarah.
Maybe you can just say out loud, like, where could people find you? Would you like people to contact you? You did mention you're on social media.
So our Facebook is eastcapehomehealth.com or whatever Facebook says, and our Instagram too, East Cape Home Health. It's pretty easy to find us on Facebook and Instagram. And we try to put bilingual content so that our supporters who understand Spanish and English can get all the information they need. So feel free to follow us there.
Thank you so much, Brittany.
No, you're welcome. Thanks for the opportunity to talk with you. I appreciate it.
All right, well, thank
take care.
you.
Bye-bye.